Administering a blood transfusion. For this procedure, you will need a blood administration set and filter, Y tubing, an IV solution of 0.9% sodium chloride or normal saline, an IV pole, an infusion pump if compatible with a specific blood product, tape, a leukocyte depleting filter if one was ordered, a pressure bag if needed, and a blood warmer if needed. Begin by verifying the physician's order for the transfusion and verify the client's identity. Explain the procedure to your client to alleviate their anxiety and have the client sign consent forms if they are required by your institution. Review with the client the possible side effects such as dyspnea, chills, headache, chest pain, and itching, and ask them to report any of these to you immediately. Explain that prompt reporting of a side effect will lead to earlier discontinuation of the transfusion and will minimize the reaction. Assess the client's intravenous access for patency before getting the blood from the blood bank. If venipuncture is necessary, insert the appropriate size IV catheter, usually an 18 or 20 gauge catheter. Instruct the client to empty their bladder since a urine specimen after the initiation of the transfusion will be needed if a transfusion reaction occurs. Obtain the client's vital signs so you have a baseline in case you detect a reaction during the transfusion. Obtain the blood product from the blood bank and be sure to initiate the transfusion within 30 minutes to prevent bacterial growth and the destruction of red blood cells. Wash your hands and don clean gloves to reduce the risk of the transmission of HIV, hepatitis, or blood-borne bacteria. 2 registered nurses or a registered nurse and physician must check the blood product label and accompanying transfusion paperwork against the client identification band. Both professionals must sign the transfusion paperwork to verify the appropriate checks were done. If there is any discrepancy found between the client information and blood product labeling and accompanying paperwork during this procedure, notify the blood bank and do not administer the product. Strict verification procedures will reduce the risk of administering the wrong blood products to the client. You must verify the client's name, their blood group and RH type, the cross-match compatibility, and the donor's blood group and RH type. The blood unit and hospital number or other identifying number and the expiration date and time on the blood bag must be verified as well. You must also compare the type of blood product with the physician's order. Perform a visual inspection to check for the presence of clots in blood. Open the blood administration kit and close the roller clamps to prevent the accidental spilling of blood. There are 2 types of tubing sets. Y blood tubing administration set. Y tubing allows the nurse to switch from infusing normal saline to blood. This is especially helpful when multiple transfusions are given. Follow the institutional guidelines for the number of units that can be given before the tubing needs to be changed. Spike the normal saline bag. It should be noted that dextrose solutions are not used with blood transfusions since they can clot the donor blood. Open the roller clamp on the Y tubing connected to the normal saline bag and the roller clamp on the unused inlet tube until the tubing from the normal saline bag is filled. Close the clamp on the unused tubing. Squeeze the sides of the drip chamber and allow the filter to partially fill. Now open the lower roller clamp and allow the tubing to fill with normal saline to the hub. Close the lower clamp. Invert the blood bag gently 2 to 3 times. Open the blood bag port and attach the remaining Y set spike into the blood bag. Open the upper clamp below the blood bag. You may have to squeeze the drip chamber. Open the lower clamp and fill the tubing with blood. Now, close the lower clamp. Single blood tubing administration set. When using the single tubing set, first spike the blood unit. Then squeeze the drip chamber and allow the filter to fill with blood. Open the roller clamp and allow the tubing to fill with blood to the hub. Note, the blood product should never be piggybacked into the normal saline line. You want to avoid forcing blood cells through both a needle and a venous catheter. Have an intravenous solution of normal saline and appropriate IV tubing at the bedside in case the transfusion needs to be discontinued. To infuse the blood product using either Y or straight blood tubing. Attach the tubing to the venous catheter using sterile precautions. Open the lower clamp to begin the blood product infusion. Infuse the blood slowly for the first 15 minutes and closely monitor the client for any adverse reactions to the transfusion. Remain with the client for the first 15 minutes. Monitor vital signs at 5, 15, and 30 minutes, then hourly until 1 hour after the infusion is completed. Reactions occur during the first 15 to 30 minutes, and changes in the client's vital signs can warn of a transfusion reaction. During and after the transfusion, continue to monitor your client for other transfusion reactions, such as fluid overload or a febrile reaction. Infuse the blood at a rate of 2 to 5 milliliters per minute, or according to the physician's order. Packed red blood cells usually run over 1 1/2 to 2 hours, while whole blood runs over 2 to 3 hours. Do not transfuse a unit of blood for longer than 4 hours. Remove your gloves and wash your hands. At completion of blood infusion, wash your hands and don clean gloves. After the blood has infused, allow the tubing to clear with normal saline so the client receives all of the blood that is left in the tubing. Dispose of the bag and tubing as specified by your institution's policy. Remove your gloves appropriately and wash your hands. Document the procedure and the client assessment in the nurse's notes and complete the transfusion form.